Good evening, everyone, to a new episode of Mind Explorations. Today, I'm with Dr. Gris Galvez from Texas, Brownsville, I believe. Correct? Yeah. And
Yes.
Dr. Gris is going to talk about ADHD and hypnosis, success strategies and tips for working with children. So you are not just a medical doctor, Dr. Gris, but also a pediatrician, and you are a hypnotist. So that makes for a very interesting combination. And I'd love for you to introduce yourself and talk a little bit about what you do in your daily work.
Well, hello, everybody, and thank you for being here. My name is Griselda, but I go by Gris, which is short. Galvez. I'm originally from Mexico, as you can tell because of my accent, right? But I live now in Texas. Other than being a pediatrician and a neonatologist, like Astrid mentioned, for several years, I love education. So I have a Master of Science and a Master of Education. I've been teaching mostly biology and anatomy and physiology. I'm a college professor. But for many years now, I really enjoy learning more about the human body and also the human mind and everything that now we call it holistic, which it is like an integration of everything, because we are in reality not just a body, but we are also a mind and also a spirit, right? So integrating everything as a whole, it's a better approach to help the individuals. I love hypnosis. I'm also a practitioner of hypnosis. I've been in several of the Hypnotalks Live and now in a few days in Mid-America conference in Chicago with different topics in my presentation. So that's mainly me, more now into the holistic or integration of everything to help people in a holistic approach.
Yeah, you will be talking, just like myself, at the Chicago conference, hypnosis conference, the Mid-America Hypnosis Conference on October 17th to the 19th of 2025. And there you'll be talking about synergistic hypnosis, as you just said, integrating modalities. If you'd like to join us, I'll be putting the link into the show notes and into the comments. But today we are talking about ADHD, which is, a topic that everybody's been waiting for, neurodivergence in these talks. So for people who may not be as familiar, or to clear up some misconceptions, what exactly is ADHD?
Thank you for asking. Yes, very good question. Like you say, people that are considered to be neurodivergent is because their mind may not function similar than ours. But as I always say, we all are different individuals, and when we are considered to be, normal in quotation marks, we all have a lot of different behaviors, habits, beliefs, etc. So that makes us unique. Specifically in the umbrella now of one of these conditions that are considered to be in the neurodivergent people, we have autism, right? Before, and even now, I know a lot of people that they still call it Asperger, which is part of the autism now umbrella. We have also something so mild that to me is still kind of normal, but with some difficulties like dyslexia, and some other situation where the person cannot read or write correctly. And one example is also ADHD. Before it was called with different names, but the most recent was ADD, attention deficit disorder, with or without hyperactivity. And now it's only ADHD, attention deficit hyperactivity disorder, which is one way to call it. But, you know, I really don't enjoy the part that we say disorder, because it's kind of a stigma for some people, you know, that they feel not too comfortable.
So
That
have we,
a person consider that.
yeah. So have we
Yes.
just lost the ADD children? Is only hyperactive, the hyperactive trait now a part of ADHD? Have we just taken out the rest, or what's happening there?
Well, one person may have a main component of attention deficit. Another person may have more hyperactivity. A person may have combination of both. Impulsivity also is another part of that. You know, it's a difficulty to focus, being very active, and also impulsivity, not only in action, but in saying something. What we see is that when they are children, they may have either one, both, or more specifically showing in the person. And in some cases, when they are reaching an older age, some of the hyperactivity is kind of gone, and is more of the attention deficit, difficulty to focus, difficulty in remembering things, losing items, etc. And some adults still, they are very hyper. So regardless of how old they are, they still have the full signs and symptoms of that.
Okay, so when you have a client coming in, a child coming in for ADHD, how do you know they are ADHD then? Because if they're on a spectrum, do you say, okay, only kids that have a diagnosis from a psychiatrist, I would consider as ADHD, or do you just look at the different traits that they show to say, okay, this is how I'll work with them? How do you work with
Very
any of
good
those
question.
kinds of clients?
So usually, you know, in most of the cases, we as family are the ones that notice that the child is showing, even if it's our first child, we notice that, is that normal that my daughter or my son is always doing this, doing that, and he never stops, and he's always talking. And so the family is the one that usually notice something. Maybe not necessarily mom or dad. Sometimes it's like that. The aunt, the uncle, grandma. When the child is already going to school, or even the daycare, you know, the daycare here we have in the United States, they tell the parents, you know what do you do when this happens? Or we are having difficulties in keeping your son or your daughter still, or they also notice. And when they go to school, is one of the things that they mention, the teachers mention to the parents, because it's not necessarily that they say, I cannot handle this child. The situation is that it's affecting the learning of the rest of the group. You know, in some cases, the child doesn't wait for her or his turn. They never stop talking, etc. So that's the main, in quotation marks, complaint of the teachers, that they cannot teach. And that's usually the age that they, as the pediatrician, you know, gives some medication to this child so he can function. Right.
Right. So what age groups are you talking about in this? You said daycare, that would start at 1 year or younger even. So which kind
Yeah,
of...
well, even if the child shows some signs of hyperactivity or impulsivity, in most of the cases, you don't start a treatment with medication, because sometimes it's a normal neurodevelopment of the child that later he's going to just regulate and go like a normal behavior for any child. as a matter of fact, most of the pediatricians, that's what they do. They say, you know what? No, just let her be or let him be, except if he's in danger and a dangerous situation. But if it start affecting him or her to learn, and if it's affecting others in a group, like in a classroom, then we have different forms with different evaluations for questions. You give it to the parents, give it to, if the child has one teacher or several teachers, like a physical education teacher or the theater or the classroom teacher, everybody receive a form to see how the child is acting or behaving, and they give an evaluation. The pediatrician collects everything. You have some points, and then you make the decision to tell the parents, okay, you know what, I think your child may be a candidate for a medication.
As a
Parents may
psychiatrist
accept it,
or as a pediatrician. Yeah, okay.
Pediatrician, yes. And sometimes, in some cases, because this is another thing that happens, that you may have another different diagnosis with a person with ADHD. And it's a long list of situations that they may have also at the same time with ADHD.
Right. So we're talking about autism and trauma, and I believe high giftedness as well sometimes. Is that correct? Those four?
Yes. You know what? You mentioned something very interesting, because sometimes a child may say, oh, this person has ADHD. He's hyperactive. He's very impulsive, and he cannot stay still in the classroom seat. Yeah, but not necessarily maybe that the person has ADHD. Maybe the person is gifted and they finish pretty soon whatever that the teacher asks, and then they already like, okay, what is next?
Yeah.
And that's misdiagnosed, like he's hyper. No, he just need or she just needs something else to do because they finish faster than everybody else.
Yeah.
So
yeah,
that's a good point that you mentioned. Yes.
Okay. So, and I'm told that ADHD and trauma and autism also can overlap. Is that correct? Trauma as well?
Yes. It's part of the neurodivergency that we have, one important point will be to have the correct diagnosis and not to leave anything, left, because you have a way to integrate everything, and instead of just treating something, you need to have the tools to help them with the different diagnosis, or to send them with the correct specialist, or counseling or psychologist or psychiatrist, etc., so that person can receive the help that they need.
So you're speaking through the lens of the pediatrician. And if we now go to the hypnotherapist who's not medically qualified, how can we help when we get a client? How can we work
Very
together
good.
with other doctors?
Good question. So yes, I'm talking right now as a pediatrician, but I also, as a mother, I had my kids with ADHD, and let me tell you that it was very difficult as a parent, because even if I already learned the condition and you learn the signs and symptoms and you learn about the diagnosis and the treatment, it's different to be a parent and suffering with your child, because these children are kind of always saying, oh, no, don't play with that kid because he doesn't know how to play, or he doesn't stop, or he never stop talking, or he doesn't wait for the turn. So these are kids that they are, in most of the cases, rejected, not only from the group of kids, from some members of the family. Also, they are rejected for some teachers, and it is hard as a parent to go through that, because you see how your child is suffering by not being accepted. And that's one thing that we as a parents, we need to be the main advocate for our children when they have any condition. Right now we're talking about ADHD, but it could be anything, not only autism, but any other condition or disease when the kids are not being accepted. As a hypnotist, most of the cases when we have a parent that is contacting us, they already have the diagnosis most of the time. Right?
Mm-hmm.
If they don't have the diagnosis, probably you can ask the parent, they're very good telling you. They may say, yes, we have the diagnosis. We don't want our child to be on medication because all of the side effects of the medications, They may say, no, we're not there yet, or we're waiting for the kid to be in school. But what do we do now? That everybody is kind of, in quotation, suffering with his or her behavior, and what can we do to help them, but also to help us, to have more patience, etc. So you can offer hypnosis. And one of the very first things that I do, and it works for me, right, is to have a conversation with the parents, because they're going to help you to help that child. We need to learn about what the kid is doing, what the kids like, what possible things may help him or her to be a little bit, quiet or calm or confident. So when we have them in our office, we're kind of ready for them.
Yeah.
One of the things that they notice in their everyday life is that they are surrounding for a no world. No, please don't touch that. Leave that. Yeah. Sit down. And a lot of restrictions, right? They are just doing things that naturally it happens to them because of that condition, right? And the people that are surrounding are the people that we have no patience. Sometimes they don't know. They think that there may be spoiled. The kid is, under no parental control. So the parents are not good parents, and we are judged too. So it's something that you need to help both, parents and kids.
So, so which challenges, first of all, which age group would you say can use hypnosis, or can you do hypnosis with in children? And what is it that you help children with ADHD with? What exactly do you support them with in hypnosis terms?
Usually what in my case is for children that are already in school, or here before they start in first grade in elementary, they also go to pre-K and all that. But again, you try not to pay too much attention, but just to kind of help me in other ways. But this is how I do. If the child can be having a conversation directly or indirectly in the office, regardless of the age, you can help them. Maybe a person that it's already not only 6, but 5, 4, because as we all know, hypnosis is just to ask the mind to focus on something. And as a children, we need to talk to them in their language. That's why it's important that you contact the parents, preferably if they're not there yet, like in a phone call, or you can even have a meeting with them before and ask them, okay, how do you call your child? Is it okay if I call them the same name? Because sometimes say yes, but we just call them like that, not everybody else. So a lot of details asking. If look around, what do you think they may not like from here? And that works also for kids with autism, okay, you know what? He's afraid of that kind of figures. Or if it's too bright, it's not going to work for him. So we need to ask the parents what may work for them. So when they walk into your office, they feel that they're welcome and that it's an environment that is nothing that they're going to be worried about or even distracted. That's the other thing. For ADHD kids, the parents help us for us to be ready to talk to a child.
Yeah.
See?
So you make your rooms, your office as welcoming as possible?
Yes, and I don't have a lot of stuff that I'm afraid like oh, that is gonna be broken. Well, don't have it in the office, or at least remove it if you're gonna have a patient that particular day. Let him be. So sometimes the kids are just kind of running and running and running. I say, okay, when he gets tired, he's gonna sit down. And if not, I invite him. Wait, do you think if will you be okay if we sit down for a second? And they say, yeah, sure. If they wanna lay down on the floor, let them be. See, if they wanna sit in a couch and just spread all over the place, let them be, because that's how they're you having a rapport with them, and also they're gonna feel comfortable. Something that I have, I have some toys,
Oh yeah.
like they can be always touching or moving or squeezing. I don't have a spinner with me, but that's the one that I usually like. I have like some kind of toys, like it's something that helps is for them to be making either
Noise.
sound, or they tell
Yeah.
you noise, whatever. You just use the word that they tell you. And when you have a conversation at the beginning, you can ask everything that you may use later in the induction or in that deepener or any part of the hypnosis session, and use their words. If they tell you, I always wanted to be Superman, and then you say, okay, now you're Superman and you're flying or you're helping people with your vision, whatever, right? That's why it's very important to have the collaboration of the parents, because the kid may not tell you something, but the parents already did. And you talk to the child,
Now,
Yes.
with hypnosis, and I know this is a question that many practitioners have, ADHD running around and then sitting still in hypnosis, how does that work together? Do you have them sit still, or can they still run around if they want?
Okay, what I do, I let them, in the meantime that I'm asking them questions, and not necessarily like, okay, what is this? What is that? I try to write down, not as, the minimum, but I try to keep it here. And if I think I'm going to forget, pues I write it down. But I let them be all over the place. And once that they get something to touch, and I usually they like to play something, music. And so they're answering my questions, and then depending of the age, you tell them, you know what, in a moment, I'm going to ask you to sit down here with me. Do you prefer to be sitting in this chair or in that chair? So give them choices, because remember, these kids, they most of the time being told, no, stop, don't do that, don't touch. So they're going to feel that you are with them, that you like them and you're not rejecting them. So you like the chair or this chair? No, this chair. Okay, in a moment, I'm going to ask you to sit down here. If you rather be over there on the floor, I'm okay with it. I go and sit down with you. And sometimes they tell you, no, come over here and sit down here with me. So you need to sit down with them on the floor, right?
Yeah.
So yes, that's what I do. I let them guide me what they prefer to do. And the sessions usually are short, but one thing is that they, regardless if they are very hyper, they are very easily to get into hypnosis. Children are usually very easily to get into hypnosis. And then depending of the age, you tell them, like something like, okay, I'm going to ask you to smell the flower, but you're going to smell it very slow and very deep, because you want to get all the aroma. Okay, let's do it. And then they start smelling the flower.
Mm.
And then you're going to turn over here and you're going to blow a candle. Just like your birthday cake. Yes. Okay. Then you're going to blow the candle. So, but you're going to blow it very slowly because those are the kind of candles that you cannot,
Blow it quickly.
turn it off
Yeah.
very,
Yeah.
quickly. So they go like, and again,
So,
depending of the age, you may tell them, you have the balloon and over here you have the books, etc. So you use whatever you think may work with them. See?
so a
Yes.
quick, short induction, if possible.
Yes.
Do you use any
Yes.
rapids or any hand drop inductions, anything of the kind?
For children, I not necessarily use them, but I've seen them that they work more in a little bit older, like in teenagers. Probably a few times I've used only like, rapid induction. I try to use more like a progressive, but at the same time, not that slow because they start, moving around. But sometimes when they have something in the hand, that's it. They are always going to be doing the spinner or some of these, even they can be under hypnosis, and you still see that they are moving some of the fidgets, and that's it. They have something to do. That helps a lot.
Right. So which you talked about teenagers just now. So we're starting with kids that are 5 years old. And that's the storytelling, that's the running around. From what age are kids, ADHD kids, able to sit down more or to do a more standard session? Or are they still as jumpy as teenagers as they were as kids?
No, it depends. Sometimes by 7, 9, they some of the kids start, kind of slowing down. And for teenagers, in most of the cases, they can be already sitting or laying down normally. But sometimes and they tell you, you know what, I cannot stay still. Okay, what do you like to do? And they say, can I be standing here for a while? Sure. And then when I ask you, then I'm going to ask you to sit down. You can lay down and, recline or get the pillow and lay down on the floor. And they can do, again, teenager is difficult for them because they already come from many years being in a difficult time, with the teachers, family, etc. And now they're going through another age that they want to find their own identity, to get related with groups. And also they have a different kind sometimes of rejections. It maybe they already have a relationship with a significant other. Sometimes it's difficult for them also to have the connection because sometimes the other person doesn't have the patience. So another things start getting into the teenager's mind too.
Yeah. So going back to children, so their parents will come to you most likely. And do they want you to use hypnosis instead of medication or complementary to medication?
Very good question. I like that question. Sometimes it depends on the parents. Sometimes the parents ask you, I don't want to go through the medications pathways. I don't want my child to get the medication. In some cases, it may work just with hypnosis. In some cases, the same parents come back and tell you, you know what, we had to start medication because he had these changes, but the teacher in the classroom notices this and he's not learning, or he's not allowing some of the kids to learn. So we noticed this improvement, but for school purpose, he started with this dosage, So we use it as a complementary in that case, right? And again, in some cases, it works perfectly, and that's the only tool that you need, hypnosis, regardless of the age, because it may work for a child, a young child, but it may work also for a teenager, even with adults. I also have clients or patients that they're adults, and they want to focus. They want to not to forget items. I always keep forgetting where my key is on. So they tell you, you know what, I focus more. And one important thing that regardless of the age, I always like to work, even if the parents didn't mention, even if the kid didn't ask or the adult didn't ask, I like to work in the self-esteem because that's one of the points that it's affected, it's affected. And we need to make them feel valuable, loved. And that's one of the things that you can also include in hypnosis, letting them know you're pretty much loved, you're very talented, etc.
So you work on self-esteem, on concentration. What other topics do ADHD clients or parents of them want to work on?
One of the main things is to the grades at school, depending if they are in school, so they can focus, they can memorize, they can concentrate, they can stay still. So that's the hyperactivity and impulsivity part. As they getting older, with the relationship with friends or with significant other, and adults, usually they ask you to focus, to keep a good memory, because one of the things that happens to most of the person with ADHD is they lose a lot of items constantly.
Oh yes,
because the same thing, they're not focused. They're forgetting, oh, where did I put this? But at this age, like mine, happened to me now, that where are my keys? Oh, I have it in my hand. Oh, okay. So yeah, but those are the things that they usually ask for.
Yeah, right.
But I'm sorry, but it helps also with impulsivity. So when you talk specifically, put in the command that say, you know what, you want to focus, you want to take your time, you want to concentrate, and also it works with impulsivity, not only for action, but also with words, because that's another thing that people with ADHD may have, that they say something and then I shouldn't have said that. So
yeah, I know what you mean. Yeah. So I have a question here. Can hypnosis be enough? Can it completely replace medication as well? I suppose that means.
Yes. In my case, yes, I had patients that it was the other way around. They were already diagnosed. They were already taking medications. And because hypnosis worked for them, the dosage either was lower, and some of them was completely stopped because they felt that they didn't need it. And these were at some teenagers and adults, the kind of older patients. And just hypnosis worked by itself because they had to stop the medication. One of them was because it started having like side effects of some of the medications. And he felt that the hypnosis was enough at that time. He didn't need the medications. And the couple of follow-ups that we had, still without medication and feeling completely in control of everything that the person had.
So, okay, from a scientific perspective, then, how can hypnosis impact the behavior in ADHD, or how can it change the brain?
Okay, so as you probably know, and some of the people that are here, the purpose of hypnosis is to give the mind tools embedded in your subconscious mind. So any of the behaviors, actions that the patient has or the client has with ADHD, that's exactly what you want to work with. And to arrive to that point, you already get what information that the patient or the parents is giving you to work specifically. And just in case, as I say, I always ask I always like to add some other things that I know is going to be beneficial for them. Once that you have access to the subconscious mind, the brain is ready to get all this information, to accept it as a fact, and the person may start working with that with those particular commands. That's how it works, because repetition is good, and having the commands to the brain. Scientifically, we know that that's how our mind works, that they never accept a no, it's always ready to get the most benefit for that person. So some of the hormones and some of the neurotransmitters, that's another topic, but yes, they work in conjunction with the hypnosis, because you're given the command to start working in those particular signs or symptoms of ADHD or any of the other neurodivergent conditions.
Well, I know that Dr. Rachel Gillibrand from the UK did last year at the UK Hypnosis Conference did a talk on how ADHD and autistic brains experience hypnosis differently with she was measuring them with electrodes, I believe, and you could see different parts of the brain light up during hypnosis. So do I have to imagine that the brain, the ADHD brain, stays the same, but we implant different commands through hypnosis, or can we change the neuroplasticity of the brain to make it more neurotypical, so to speak?
You get a very important point, and this is what I tell my students, probably I was from the age of the dinosaurs, so I don't know, because we didn't have at that time all the tools that you have, like videos from YouTube, or as long as they are reliable sources, go for it. We have to learn with the book and pages and trying to imagine, okay, it says that it goes like this and it goes like that. Because I learned it and I used to teach many years ago, like, okay, this is what happened, the neurons are like this, and that's it. No changes of the neurons. That's what you have. You're done with whatever you have. And for many years now, we're learning everything about the neurotransmitters, the neuroplasticity. And I tell my students, you know what? Whatever I'm telling you and teaching you right now, you keep reading and studying, because who knows, this is going to be true in 1 year or in 50 years from today, No, now we know how we can work with neurons, and that's how a lot of things, even the law of attractions and a lot of other new stuff that from the last years, I'm glad that the world is opening to all of these new tools. That's why I feel like all the different modalities, including hypnosis, now are better received for people. So I think hypnosis has a beautiful future, because the people now has like more open mind. So yes, now we know that we have the capability and the ability to modify our brains, regardless of how old you are. So yes, you can work with the neurons, with the neurotransmitters, to adapt these people with different conditions to be more neurotypical, like you say, right? And to eliminate some of the actions or symptoms or signs that they have. So yes, hypnosis works perfectly for that.
Wonderful. So just a quick one. So we have lots of symptoms of ADHD that are different: running around, hyperactivity, not being able to focus. Are these symptoms, can we just take the symptoms away, and then it's not ADHD anymore? Is it just a collection of symptoms, basically, is what I want to know?
Yes, as I mentioned, it's a condition of the neurodevelopment, that some kids have. at the beginning it was kind of difficult to say, oh, this kid is going to have a hyperactive or what. Yeah, but the kid is 2 years of age. So that's a normal situation for that 2 or 3 years old being just running around and being very hyper. But eventually, some kids, they stop having the hyperactivity or the impulsivity, but then they stay with the attention deficit with no able to focus. And some kids just keep going until they're teenagers or even adults, you know.
Yeah.
So they may say, you know what, I have this diagnosis, but I no longer have this and this and this. I just can handle, because you need to have the help not only from the doctor or from the counselor, from the family. And in hypnosis, the patient, you can teach them how to do self-hypnosis. Maybe you can provide them with anchors and say, whenever you feel like this, use this anchor, you know, that you already have it placed there by the hypnotist. So they can self-regulate, they can auto-control, and they can help themselves because you already gave them the tools to do that.
And can we say a similar thing for autism?
In autism, it has to do a lot what level of autism the person has, because some people, what we used to call Asperger's syndrome, they're completely functional except for a few things that you notice, like, okay, this person is very impulsive to say this, or doesn't have a lot of eye contact, or why the person say that. And you notice, like, may not be completely, you know, like the rest of us. So they be very functional. They can be very functional and just like anybody else. And some other levels of autism that may be severe. The parents help you a lot to help them. Because again, you can have them in the office and have everything ready for them, probably to lower the lights, avoid noises, even to use your voice, either like soft, like a friend, or for some kids maybe the opposite, more like authority. So that's what the parents help you. You can still help them, and they can still get changes with hypnosis, you know. We have a person that I think you mentioned, she's about nutrition, I think you say.
Yes.
That's another topic, but yes, for both, for people with ADHD and for people with autism, other than integration of everything that we already mentioned, food is very important. Nutrition is very important for these kids. But yeah, autism, it can be helped also with hypnosis, depending of how severe it is.
Okay, so you said nutrition is very important. So that's one thing you would teach the parents, nutrition, or send them to a nutritionist. Is that right?
I rather send them to a nutritionist because, you know, as a pediatrician, yes, I can suggest certain things, but right now, since we want it to be for everybody, people that, like you mentioned, may not be too close to the health workers, right? We can always send them to a nutritionist, but for sure you can say, you know, try to decrease the carbohydrates, sugars, food with certain colors. So you can give them a general idea what to avoid, and
But
always
no
better
specific
with
advice,
send them with a person that can help them specifically with that.
And I just would like to go back a while again to the parents. We've discussed what you would do to help the children, but how do you help the parents? Do you use hypnosis for the parents as well?
Well, in my case, it's not too common that they ask, but yes, they do. And sometimes may not necessarily go through hypnosis, again, unless they wanted to participate like that. But if the parent is already trying to help their kid, that's a very good point for them, because they're trying, even if it's to help the kid or even to help themselves, like, I want to have more patience. That's good, So I always give them general advice, like obviously try to have patience, try to speak to them at their level, and not only at the level of the height, but also at the level of their words. And to be the advocate for the kids, because, it's a difficult work in general. Imagine for the kids that are being rejected. So yeah, I give them general advice. Also, if they would like to, I provide some worksheets, so what they can do with the kids together. And if the parents ask, what, yes, just help me with hypnosis so I can be kind of more open, more patient, and yeah, sure. But more frequently, no, the parents don't ask.
Yeah.
It's not frequently that the parents ask for hypnosis for themselves to help that kid. No.
Okay. And if they want to, if they come to you for the first time, either teachers or parents or whoever, caregivers, what's the first step you'd want them to explore or to find out about when you're talking about hypnosis for ADHD?
Yes, well, if they already have the diagnosis, because sometimes they already know, and sometimes, like I have a couple of times that they broke a child. It was like 3, and the other ones was almost 4, but it was a pretty normal behavior for a child. It was not really ADHD. So yeah, we go through what possible signs or symptoms they see, and we figure it out if it's a possibility that maybe ADHD. If the patient is already diagnosed, because that helps, that say, okay, let's focus on this. I really like to see like a connection between parents, teachers, the rest of the family, because everybody need to help the kid,
Yeah.
As I said, one of the very important thing is to know what the children is going through, and that no, it's not that they are spoiled. It's not that they are no good kids. It's just something that was different in their mind. And we don't talk about, it's children that are normal. Wait a minute, what do you mean? They're normal too. See? I'm glad that nowadays they are trying to mention a new term, which is more like a variety of condition of how our mind and our brain works, not necessarily to put it like a disorder, an abnormal, etc. So not to get children with a particular term,
Yeah. So don't
Yes.
put a stamp on them. Don't label them.
Yes,
Basically, yeah.
yes.
And do you get children where school and parents, everybody says that kid has ADHD or autism, and the child itself is just like, this is just me, this is normal? Do you still do something for them? Because, we want the client to want to change before we help them. But if the child doesn't see anything wrong with them or doesn't see that they need help, how do you help them? Or is there even any reason to help that child?
Yes. One of the things that we try with parents and everybody that gets close, like rest of the family, or we tell the parents that in a very nice, discreet manner to talk to the rest of the family, because we need to modify the words that we use to refer to these kids or to these teenagers or to these adults, because they say, what's wrong with you? there is nothing wrong. At least
Yeah.
we need to let them know that they are like any other children, but just the mind may work a little bit faster than
Yeah.
other people. Or they say, it's que they don't pay attention. You know what? What if it's not that he's not paying attention, is that he's actually paying too much attention to everything. See?
Yeah.
So we tell, no, you have a superpower. Because some people can concentrate and focus in one thing. You can actually concentrate on a lot of things. So they start feeling better. They start feeling like, you know what? Yes, you're right. There's nothing wrong with me. No, there's nothing wrong with you. So that's very important. And they know that whatever other person say or do, don't feel it like has nothing to do with them, and say, you know what, it's just the way that they think, but you are actually very talented. Just try to focus in finish whatever you're doing. And that's exactly why you want to put it in hypnosis, trying to help them to concentrate in a particular thing. But yeah, this is, one of the things that I went through that as a mother. Teachers telling me is that your child is spoiled, or you don't have control, or bad parenting. And so nothing that is not gonna benefit the children or the relationship with their parents is gonna help. It's just better to be in approaching all this in a very positive way, to always be an advocate for the child, and make them, the patient or the client, to feel okay, to feel like
Valued,
there is nothing wrong with me. I'm loved, I'm talented, I even have more talent than other people. Perfect. Yes.
Wonderful. We have a question. How many sessions do you normally do with a client, and how often do you do them?
Okay. I like to have between 3 and 5 sessions, but in some cases, the parents wants to continue bringing the child, like every month or some other. Can we come back still every 2-3 months? But it's more than a follow-up or for reinforcement. I noticed in my case that the children wants to do it, like I want to make sure that everything is continue working perfectly. Or sometimes they just want to come back to the office, because they feel validated there. So but yeah, to answer your question, sometimes 3 to 5 sessions. That's how I noticed that you have a permanent change. Sometimes even you can see a big change by the second time that you see the patient or the client. The parents are already telling you, big change.
And very quietly. So do you see them weekly then, or is it just flexible whenever you can?
It is better if you see them like kind of relatively close to the next session, like kind of 7 to 10 days. But in some cases, because different circumstances, usually the parents, you see them like every 2 or 3 weeks. Yes.
Okay. Yeah. But does that make a difference, or is that?
In my case, I have not noticed that it's affecting. A couple of patients, yes. The parents say, do you have something sooner? Sure, come next week. I have an opening, and it's not more than, let's say, he's still very active. Is because the kid wanted to come sooner. Yeah, I want to go back to.
So. Well, that's wonderful if when it works like that.
They like it. They like it. They when they notice themselves a difference, and when they feel validated, that when they feel that there's something that is not a teacher or a parent or a family member, that they're telling them that they feel validated. So
I know
like
when
that.
when you tell a child or a teenager that you need to go to therapy because you have a problem, that's not going to work very well. So
No,
yes,
no,
feeling
no. We
valued is
need to be
important.
very wise in using our
Mm,
words
yeah.
with them. Yes.
Yeah, wonderful. Thank you so much. I think we're running out of time because you have to go to another interview today. TV, I believe you said. So,
Yeah, I'm driving 1 hour for
yeah, we're not
radio.
going to keep you too much longer. Thank you very much. I have put the handout that you've created into the chat for everybody who's there live. Everybody
Perfect. Yes.
who watches the replay will see it in the comments, and I'll find a way to somehow put it on YouTube as well. So, thank you so much, Gris, for being with us today and sharing your knowledge. Amazing. I think I learned a lot. And yeah, I will see you in Chicago in about 3 weeks
Yes.
at the Mid
Thank
America
you very
Hypnosis
much.
Conference. You are
Thank you
welcome,
very
and
much for the
thank you again.
opportunity, Astrid.
And Mandy says, thank you. This has been great. Thank you too for
Thank you
joining
both so
us live.
much.
There you
Thank you.
go.
I see
Oh,
you
thanks,
in a
Maggie.
few days.
Yeah. All right, then. Have a wonderful day, everyone. Thanks for joining and everybody joining on replay. We are back tomorrow with, oh God, I have lost the page, with Rebecca Wagner and the Milton
Rebecca
model.
Wagner.
Yeah, words that work. So I hope you tune in again or join me live tomorrow with Rebecca. And
Yes.
yeah, you have a wonderful day, Chris, and I'll see you in 3 weeks' time. Thank you. Bye
Thank
bye,
you. Thank you,
everyone.
everybody. Bye-bye.